Hi, my name is Dr. Bill Owens. Thank you very much for your interest in the Academy of Chiropractic and chiropractic research. I wanted to take a little time, just a minute or two, to discuss a very, very important article. And this article has allowed me to really build relationships in the medical community and has resulted in hundreds of patients and referrals that we've been able to help and manage their pain. This article was published in the Journal of Electromyography and Kinesiology back in about 2012, early on in 2012. And we've known from a chiropractic standpoint that the chiropractic adjustment does help modulate pain. Simply put, when people come in and they're not feeling good, they get an adjustment, they leave, and they feel better. We've always known that that can only happen unless there's some interaction between what we're doing with our hands and what the nervous system is receiving. And anecdotally, based on clinical experience, that's been the story of what we've been as a profession for a very long time. Although we don't chase pain, it's also a very important component of why people come to see us. It's human nature to seek relief, and as you know, a lot of what we do provides that. This paper was critical because it talked about spinal manipulation, and I know we don't manipulate, and there's a difference in rhetoric between spinal manipulation and the chiropractic adjustment. But from a research standpoint, the movement of a joint in the spine can be categorized as spinal manipulation, or if it's done for the specific technique in mind, with a particular assessment, we would call that the chiropractic adjustment. However, with that debate aside, the title of this paper is Changes in Pain Sensitivity Following Spinal Manipulation, a Systemic Review and Meta-Analysis. And what's important about the meta-analysis and systemic review, this isn't a single case study, nor is it a study of a group of patients. This is a review of all of the literature that's available on this topic. And what they found, and this is very interesting, they found that the effect of spinal manipulation on pain threshold in patients was significant, and that when they received spinal manipulation, their tolerance to pain went up and their sensitivity went down. So what does that mean? That means that when they get adjusted, they feel better, and we know that it's not from a spinal nerve root, it's not from the lower motor neuron standpoint, it's actually from the higher centers, the brain and the cord. So the spinal manipulation, chiropractic adjustment, however you want to refer to it, has a direct effect on the central nervous system. That fact has now been proven in the scientific research. So how do you translate this into your practice? I have discussions with medical personnel and providers on a daily basis about how we can manage pain without the use of opioid-based medications, or if the medical doctor determines that those are important, we can help reduce them. And that's certainly been the case. So as an example, I often ask medical providers this. If they had a patient that had chronic headaches that we knew were cervicogenic in nature, so they're coming from the neck, and that patient had carotid artery plaquing, had central spinal canal stenosis, had severe degenerative disease and instability, we know that that patient is not going to be somebody that we're going to aggressively work on. But this research paper now I can hand to the medical doctor to back up what we've known clinically for 116 years, is I can work on the patient's thoracic spine where they're healthy to decrease their pain threshold and make them feel better without even worrying about the neck. And that is one of the global effects that chiropractors have always known about, but until now the research is actually showing. This is what we share with the medical community, and this is how we build relationships. So I thank you for taking the time to review this paper with me. If you have questions on its content specifically, please feel free to email me, and I'd be more than happy to talk with you about that. Thank you very much.